I'm Dr. Melanie McLaren, naturopathic doctor. So I help people with chronic health issues, try to be preventative. Talking about our bones and osteoporosis, osteopenia today. I do a lot with hormones, allergies, digestive problems, mood stuff, thyroid. So that's kind of like my focus. So definitely, mostly dealing with women. So, with our bones, definitely making sure we're taking care of those. Um, so just a couple things as far as could be possible bone mineral deficiency signs. So this is not necessarily just tied to calcium. It could be other minerals that can also help your bones, like your magnesium. Um, so those are just some things that people might see starting to happen when they're feel like they're getting some mineral deficiencies. Some risk factors, as we get older, unfortunately, kind of looking at those things are hormones. So postmenopausal, or if you're like small body frame, some other things that could be if you're hyperthyroid or hyperparathyroid that you just want to make sure you watch with your doctor or someone like me. So those are things to take. I mean, there are some genetics too. Definitely being sedentary, which we'll talk about. Another reason to do yoga. So, a lot of people don't know this, but caffeine can deplete your calcium. And I'm not anti-coffee. I drink a little bit in the morning, but it's just good to know that, like, if you're drinking a lot of coffee, you are also leaching calcium from your body. Um, if you do, some of the research has shown like 40 milligrams of calcium loss per day could get some bone loss, 10 to 15% bone loss per decade. So that's pretty telling. Um, so just be aware of that. And if you're drinking coffee, we want to make sure we're getting things in diet that are supporting the calcium. Um, and then antacids, sometimes I'll get a patient, they're like, yeah, I take Tums, that's my calcium source. But if your stomach is acidic and you're blocking that, you're actually blocking the absorption of minerals. So that could make things worse for you. So that's something to keep in mind, figuring out why you have digestive problems and not always blocking your stomach acid. And that's a research for that. Soda, that, I'm not saying like drink an occasional soda, but, definitely it depletes calcium because of the phosphoric acid that's in it. Um, and then the carbonation might interfere with digestion. So again, like you just don't want to be drinking like soda, like lots of soda. And then just in general, making your body acidic, which could cause other issues in the body. As I mentioned, sedentary lifestyle. So we know, I mean, I'm sure you guys have heard this, like be physically active. If you're doing Kathy's yoga class, and I know she does bone health stuff, and so you guys should all be good there, but it definitely makes a huge difference. Weight bearing is very important too, for that as well. So just keep that in mind. I'm not anti-medicine and as wherever patients are, but I think there's not a lot of education that's done with some of the osteoporosis drugs, a certain class of drugs that, even dentists now will ask patients if they're on those because it can cause bone loss in the jaw. So they're not really, fixing the problem, I guess, so to speak, displacing calcium. So just be aware of that, if that's something you're going to do. So they do not grow new healthy bone. And so they're kind of reducing the body's ability to even get rid of the dead bone cells. When you read those inserts, it'll even say like possible calcium deficiency, which is kind of weird. So just be aware if you, are considering those, just be educated about that. So the good news is osteoporosis with lifestyle and exercise, diet, some supplementation is preventable. So that's good. As far as calcium, it is like one of the major structural mineral bones. Um, and then it doesn't function in isolation, meaning you need some other minerals and nutrients to help it work. It's only one component of bone. It's sometimes, people are like, oh, I got to take calcium because my bones. And yes, that is true, but there are so many other things that we'll discuss. And this is a lot of information. I'm not going to like go through and read all this for you guys. We'll send that out to you. But this would be an example of other things that could help your bone health. Calcium, of course, and that this tells you exactly what these nutrients do and the foods they're in. So, we want to make sure we're eating foods with calcium. And even if somebody's like sensitive to dairy, I mean, leafy greens, your fatty fish, are very good sources of calcium. So it's not just in the leafy greens. And then, most people have heard vitamin D, so you need that to help you absorb your calcium. So some sources there. So I think for women, one thing they struggle with too is the protein. So you want to make sure you're having sufficient protein intake. I'm not like typically telling people to do like super high amounts of protein, but tracking that and making sure you're getting, on the low end, 60 grams. And if you're very active, it might be more than that. As we get older, we may need more of that. But so then again, we'll hand this out too. But K1, K2, zinc, phosphorus, vitamin C, a lot of people don't realize support your collagen. So these will be good resources for you to look at your diet and make sure you're getting these foods. So in looking at the structure of bone, there's actually these crystals that are made of calcium and phosphorus, and they're the hydroxyapatite crystals. So you can see they're actually on like the collagen fibers. And there's also some other minerals that are as part of this whole matrix, but that's what gives bone like its resilience and strength, are actually these like particular crystals on the collagen. So just a little bit of structure there. And as I mentioned, calcium is only one component. They found in doing this concentrated bone, MCHC, the microcrystalline hydroxyapatite concentrate, that it could increase bone strength. So it was pretty cool when they discovered, like, okay, this is what's making bone strong. Let's see if we can concentrate it for people with bone issues. And this chart, might be hard for you to read all the small print. Again, we'll send it out, but just kind of shows like different forms of calcium if you're taking calcium. Like calcium citrate is one a lot of people might pick up at the store. It's okay. It's well absorbed. The only thing with most of these, they're not going to be like a complete bone food, meaning it's just the calcium, which that's okay. You just have to know that. And then, some of the other ones, like the calcium carbonate is like the cheapest source of calcium, might not be absorbed very well. So this will be helpful if like you are taking some calcium to look at it and see. Bone meal is not really good because it can be contaminated with heavy metals. And then the MCHC, which is the one at the top, is the very well absorbed, and it really has no disadvantage because it is a complete bone mineral. So it has the organic and the mineral components that are part of the bone, which was kind of what I just talked about. And this was a study that just showed this MCHC form of calcium, or really MCHC. We're also helping people with back pain. So because it does have all these other minerals in it, they did find during this trial that it did also help with pain. So that's kind of a bonus. It's like, who doesn't need that? And these particular patients were on steroids for their pain. Um, but they didn't really change anything with that. They kept them on it and just added the MCHC, and it helped their pain. So, yeah. So, and that's within a year, they had elimination of back pain. So, it's not going to be like overnight with this. It's not the same as like taking a pain medication, just trying to rebuild the strength there. Vitamin D, this just kind of points out that this is actually a hormone in the body. In it, you do need it for calcium and phosphorus balance. It's really kind of harder to get in diet. I mean, you do get some with like the fatty fish and eggs, but the fortified foods might have some, but kind of hard to measure. I mean, sunlight is the best for us. In Indiana in winter, that's a little difficult. So supplementing with that sometimes is needed. And then this is the product, one of my favorite products for either prevention or if someone has already osteoporosis, and it has the MCHC form in it and some vitamin D. So again, not giving you medical advice, but if you're asking me, like I've had patients completely, even that are osteoporosis, like reverse it with the product. And sometimes that requires high dosing it, and I would definitely work with them on that. But it definitely can be taken safely, preventative too, in the recommended doses. This is just saying that this supplementing with this particular product would even help when someone is not absorbing well. So this was a patient that was on omeprazole, which is Nexium, very bad acid reflux, and that will deplete your calcium. I mean, it even says it on the insert, so I'm not, making that up. But so even with doing that, they were able to see benefit with taking this product. So it, is going to help even with that happening, and I guess digestive health is something that I talk to everybody about. I mean, obviously you want to make sure you're absorbing your nutrients well so that you get the benefit from them. So that's, important. So, and this is another bone density study, 64-year-old male. He was convalescing, so he was even sedentary, and this is the improvement that they saw in the study. So pretty good. 6 months, that's a pretty good increase. And I would say, that's what I'll see. I mean, it's not going to be overnight. I would say like 6 to 8 months, of consistently taking it. So, highlight that. One other thing to consider, so homocysteine, which is an inflammation marker that is typically driven up in the body by a deficiency in folate and other B vitamins. So that is something that they did find too could help by, making sure you're eating enough foods with B vitamins, which that's, it's in various foods, but higher amounts in our animal protein products, but obviously in some grains and nuts and seeds too, and beans. But so that is something that they did find would help as well, is to do B complex, which B vitamins obviously help a lot of things like brain and energy and hormones. And so these are like the products I'll use for that. So, if somebody's kind of like, hey, I want to be preventative, I would do the Bone Builder Plus. If I don't know that they've, have osteoporosis or osteopenia, we can kind of stay at the recommended dose, or the maintenance dose. At the Bone Builder at 2 capsules a day is only 2,000 IU of vitamin D. So sometimes people need a little bit more vitamin D, but you would want to lab test that. I usually recommend I check my patients like summer and winter so that, we can see what's going on. Are you making your own in the summer? You should be, hopefully. It could be some genetics you don't, because then sometimes people have to do a little bit more vitamin D, like a 2,000 And I like the vitamin D synergy with the K1, K2. The digestive enzymes may or may not be needed. Again, that's like if I feel like somebody's having absorption issues, I might add that. Just again, if you're going to sit there and eat like healthy food and your food sources and you're not absorbing those, and it's kind of like, why am I doing that? And as we get older, we tend to have less. Now, you do get enzymes from raw foods. We get them from our diet too. So again, that's kind of a dependent on the situation. And then the B vitamins, so that could be a good combination. Other things, so I have a supervising physician. He's a DO, Dr. Scott Nall. And so that allows me to write scripts. So I do also do hormone replacement therapy, and that does help with bone health. I don't, I see patients that, are one side or the other, they like, yeah, I want to do hormone replacement therapy, or they don't, and that's fine. Like, I will work with them either way. I mean, sometimes it's family history or history. They don't want to do it for health reasons, or, they just want to, hey, let's go natural and do mostly diet, some supplements, maybe. So that just kind of very case dependent. But that is something I do also do to help with the bones. I mean, I would say the main one that helps with your bone health is going to be estrogen, like the estradiol. Um, Testosterone does give you a little bit too, because it'll convert a little bit into estrogen. But yeah, so those are options. And I only do bioidentical, which means it's chemically the same as what your body makes. And one thing I should put on here too, it's not a prescription. You can get it over the counter as a supplement. It's called DHEA, and that's actually a hormone that's made by your adrenals. And it does help support estrogen, testosterone a little bit. And I know I mentioned like, I'm not trying to give medical advice, but I just like to make the point like estradiol will help your bone health, but you also don't want to just take estradiol. If somebody's putting you on hormones, you want to take progesterone with it to kind of, balance your hormones, like work them all three together. But the other thing you would want to look at, make sure someone is monitoring, is your thyroid. Your T3 and T4, they help maintain normal bone turnover, and they help with bone growth in children and adults, and bone, I guess, maintenance in adults. And then they also do a lot with the calcium and phosphorus, making sure it gets to where it's supposed to be in the bone. So thyroid should be normal functioning too, to help prevent bone loss. Um, so so yeah, and then just, prevention, exercise, healthy diet, making sure, I do micronutrient testing, so the earlier people can start doing that and look at their nutrients and make sure they don't have deficiencies. That's preventative, or making sure your doctor checks your vitamin D, the earlier you can start, the better. They say bone loss will start usually around 40. Um, so yeah. And then, the diet, resistant exercise, supplementation is a good way to approach it. So, the questions I'll get sometimes, my doctor told me to take this much calcium, how much is in the MCHC form. The Bone Builder brand has 400 milligrams of calcium, for every 1,000. So, it's still like a decent amount, but the thing that to know is it's a whole bone complex with the other constitutes of bone. So you typically don't need, like a super high amount. That is what's in, 1,000 of the MCHC. So I get that question a lot, like, well, wait, I'm not taking 1,500. I'm supposed to be taking 1,500. So, um, can you take, if you're going to supplement with calcium or MCHC all at once? No, that's not a good time or a good thing. Your body really only absorbs about 500 milligrams of calcium at a time, so a divided dose is more efficient. I just like to point out too, the MCHC form. If you're going to take it, it is not vegetarian. It's actually derived from cow bones, from cows in New Zealand. So it's definitely not vegetarian. So just like to point that out for people that are. And then I will send you guys PDF of this, but I set up in our dispensary that people can, we have supplements here in office, but if you want to order online anything I've talked about today, I use something called Full Script, and I set up this bone health supplement kind of recommendation in there. So it'll prompt you to like create a login, like a free account, and then you can look at them and put them in your cart and order them. I give 10% off and free shipping over $50. If that's something you're interested in, or you can log in and just at least look at them. If you have any problems with that, let us know. We do also have a coupon if somebody was interested in becoming a new patient. It's $50 off. My new patient appointment is $220, and it's valid till the end of the year. But if you have any questions, let us know. And I'm located near Keystone Crossing, but I also do tons of virtual. So yeah.